Now we're going to select to whom the claims are being sent. In this table, we have all of our clearinghouses or all of our processing DLLs that have been set up over the years. Okay, the two that we're really going to focus on are Gateway and Relay Health. So we have our 5010 Relay Health, and then we have Gateway here. You'll have one or the other. Probably will not have both unless you have switched clearinghouses, but we're going to go ahead and we're going to set up Relay Health. Now, whichever clearinghouse you are using, the process for setting these up is exactly the same. Okay, you're just selecting which clearinghouse you use. You will not have to ever add a new processing DLL. That's something that our support team will take care of when you're first setting up your claims. Alright, so we're going to go ahead and 5010 Relay Health, and then we're going to see that all of the processing properties that are associated with that DLL. Okay, you won't have to worry about anything in here. What we are going to do is go into the Edit Coverage Properties. Now, when we go into Edit Coverage Properties, we have a few different boxes that are already populated. Okay, up at the top there's two tabs, Connection Identification, and then we have Additional. So on the Connection Identification, we have the first box is your submitter ID, then we have the billing ID, okay, and then we have a few addresses down here with a username and password. Those that are grayed out means that they were set up at the global level for that processing DLL to your clearinghouse. Okay, anything that's grayed out you should not have to change at all. You're going to have one of these boxes checked. Claims are going to McKesson or to Gateway. You have your ID numbers from that clearinghouse. The transmit mode, most of them are going to be FTP or ATS. Whatever it's set at, that's okay. And then we have the server addresses here that connect to those clearinghouses, as well as a username and password. Okay. The boxes that you will need to worry about setting up, the first one is the receiver ID up at the very top. Now, if you try to click in here and it doesn't let you click, on the right side of that field we have this little square button. When you click on that, it unlocks that field, so now you can go ahead and type on this. Okay, now this is going to be your payer ID or CPID that we used before on this previous screen. Alright, it's going to be 4 digits or 5 digits depending on which clearinghouse you go with. Alright, if your insurance requires a taxonomy code, we can go ahead and put that in here. Alright, this is going to be your practice taxonomy code, and sometimes that's the same as the physician taxonomy code. Either way, if the insurance requires it, we can go ahead and plug that in. The contact name, this is rarely used, but occasionally we'll come up with an insurance that requires a contact name, someone at the practice that is their contact for claims. Okay, unless you know specifically that you need it, don't worry about filling it in. Alright, then we have our NPI, our group NPI number pulls from our global settings. Okay, you can see that says group NPI here. The next box you need to fill in is this secondary. When you look at the drop down, you have two choices, employer identification number or social security number. This goes along with the NPI on your claim file. We're going to go ahead and choose employer identification number, and then we'll type in the tax ID number just below in that field, and that will send it in the appropriate loop and segment for this electronic claim. Okay, down at the very bottom we have additional. It's not too often, since they created the NPI, it's not very often we need to use this at all, but in the event we could go ahead and put in, you know, a commercial number or a Medicare number depending on what coverage. Alright, otherwise leave that blank. So, this is all of the coverage specific information. When we click on the additional tab, there's a whole bunch of boxes on here. Okay, most of the time you will not need to do anything with this at all. Our support team is going to help you get these set up, and they should all follow the same global properties. However, if we did happen to have an insurance, for example this United Healthcare, they want to have the claims grouped by the rendering provider instead of by the billing entity, then we can come check this box just for United Healthcare and not have it affect any of your other claims. My recommendation is before you check anything in this screen, call our support team. Make sure that that's really what you need to have, and we'll help you get that set up. Okay, so now we have our HCFAs set up for electronic processing for the physician group. Okay, now if I go ahead and click on the physician surgery, it shows that we have not set this up to go electronically because they are two different billing entities. Now, with the surgery center, of course we want those to go electronically on a UB04. So I'm going to leave this one to print on a HCFA because if the surgery center is the billing entity and there's, a data entry error, something got entered incorrectly, and so the claim's not going electronically, it will print out on a paper claim, which is going to get your attention to go in and fix that claim so that it can process correctly. All right. So physician surgery, we're going to go ahead and click on the facility fee processing now. Facilities, the very first few things are a little bit different, but after that it's exactly the same as the CMS 1500s. With the facilities, we have to specify what facilities go or require a UB, because your clinic may not, but the surgery center will. So we're going to go ahead and check the box that coverage requires a UB for the following facilities. And then it says these facilities require the UB processing. So we're going to go ahead and right click and we're going to add a facility. And I'm going to go ahead and say that the St. Mark's Hospital, if it's that facility for this billing entity, then it has to go on a UB. Now, I have two choices. I can leave it to print or I can send it electronically. We're going to go ahead and go electronic. Same thing. We're going to pick our clearinghouse. If I want the secondary claims to go electronically, I can uncheck these boxes and then I can go in and edit my coverage properties. Okay, same thing. We have our payer ID in this first field. Down here under secondary, we're going to go employer identification number and we're going to type in that tax ID for that facility, okay, or for that group information that's needed. Again, everything that's grayed out is pulled forward. In the event that you have a different submitter number with your clearinghouse for the facility, we might have to change this information for that coverage plan, but we again can guide you through that process. Okay, under the additional tab, it's all of the same checkboxes. If you need to have something checked in here, call support first and we can help set this up the right way. The reason there are so many checkboxes is because over time each insurance wants something slightly different, and so we've had to make exceptions for those insurances. Okay, for example, recently they all decided they wanted to see that zero paid amount, so we added a checkbox to allow that zero paid amount to go across in the claim file. Okay, there's a whole bunch of different options in here, so just call our support team if you need help with this setup. Okay, so now we have both of our billing entities set up to go electronically. The surgery center is going on a UB. The group information, the group entity is going on that CMS 1500 form electronically. Okay, so when we go back out here, our insurance is completely set up. It's ready to go, and we can start billing those claims. Now, if you do have any questions about anything in this video, please call our support team at 1-800-695-6994, option 1 and then option 2, and we'll be happy to help you. Thanks so much and have a great day.